Sharpen, Masters of Surgical Education.
This is Samuel George, consultant plastic surgeon. The video today is on how to design and perform the Z-plasty, 4-flap-plasty, and 5-flap-plasty. So indications for these Z-plasties are single band contractures with adequate adjacent soft tissue. We can use them for first Webspace releases, and also for closing linear traumatic scars or surgical scars across joints primarily. Now the Z-plasty is used for two purposes. One is to reorientate the scar in either 90 degrees or various other degrees, or to lengthen the scar. If we think about the design of the Z-plasty, it's essentially a Z. The central limb stays the same and is your scar, and the side limbs basically have different degrees. There can be 30, 45, and 60 degrees, which are common, and for each 15-degree increase in angle, the length gain is 25%. If we think about how to design this, so you have your initial scar that you want to reorientate or lengthen, and you mark out your new desired orientation. You excise the scar, and then you plan two limbs from the ends of the scar. Once you raise the flaps and transpose them, your middle limb will go from vertical to horizontal in that case. If you had a slightly oblique scar, you mark your desired orientation as usual, and then join the ends, and you will end up with a Z like this. In this case, you will end up with a potential of another angle that you can use. In these cases, we usually use the smaller angle that is more practical to close. Going back to the design of the Z-plasty, it's easier if you think about it as two triangular flaps. So these triangular flaps are raised, and then they're transposed and resutured. You have to think potentially you might have a band underneath the skin as well, which needs to be released, which we'll demonstrate later. So we will demonstrate the Z-plasty in its simplest form on the axilla of this chicken. So the axilla has a single band of tissue contracting across, stopping abduction of the shoulder, which we can feel there. And it's good to practice this in a three-dimensional model such as this chicken axilla, as it helps you understand the three-dimensional nature of the use of these contracture releases. So we've marked out a roughly 60-degree angle for our limbs and the central scar as well. And what we'll do first is we will excise the central scar and then raise our two limbs or two flaps. Once we raise the flaps, usually if you have a scar, you have a band of tissue underneath which needs dividing, which in here I've demonstrated by dividing the muscle. We then suture in the two apexes of the flap and then the rest of the flap. And what you'll find is that tenting skin that went across the axilla is now flat because the scar has been reorientated perpendicular. And that scar that was tented above is now flat down into the concave surface of the axilla, and the chicken can now abduct his arm freely. We'll demonstrate this again in the groin crease of the chicken. Now this is to demonstrate that you don't have to use the entire scar to perform the Z-plasty. So you can just use it as a fire break in the center. This is useful when you have large scars, like some that you might get across your nasolabial fold, and you just want a fire break just in the middle to reorientate that scar and prevent the tethering across a depression. So similarly, in this case, we've marked the Z-plasty that we decide to perform in the middle half of the scar. We excise the scar and raise the flaps just in the middle part where we've marked, avoiding the ends of the scar. And as before, we transpose the flaps across and stitch them in. And we can see quite clearly here the scar has been reorientated perpendicular to what it was before, and you don't have tissue now tenting across that groin crease anymore. Now, the way a scar is actually lengthened is because you're recruiting additional tissue from the surrounding area into the area of the scar via your Z-plasties, and hence the entire area of the scar is now lengthened. If you didn't have enough tissue adjacently, you could perform multiple Z-plasties, which are smaller, and 2 Z-plasties at 30 degrees would give you the same amount of lengthening as a 60-degree Z-plasty would. Now we'll talk about the 4-flap plasty. So the 4-flap plasty is useful for web spaces, and essentially is you have your scar in the middle and you have 2 90-degree angles. I usually make this a bit less than 90 degrees so the total area is less and makes it easier to transpose. You then bisect these 2 90-degree angles by something a bit less than 45 degrees. We then label each of these flaps A, B, C, and D, so it's easier to figure out where they're going to go. Essentially, the flap B will transpose 2 places to the apex between D and the adjacent skin, and flap C will transpose 2 spaces to the left to the apex between A and normal skin, and we'll demonstrate this a bit clearer. In the end, you will end up with a configuration like this where you have CADB, and the good way to remember that is that it's Cadbury. But what's happened is essentially C's gone 2 flaps to the left and B's gone 2 flaps to the right, and A and D have gone 1 flap to the right and 1 flap to the left respectively. So we will demonstrate this now on the other axilla of our friend the chicken, and I've marked out the 4-flap plasty here ready to go. You can see the first 90-degree flap and the second 90-degree and 45-degree flaps. As always, we cut out the scar after labeling A, B, C, and D and raise our flaps. And we release any deeper contracture that might be present. Once we've sutured all the flaps in, we can see that the tenting across the axilla is now down and the chicken has free abduction of the arm. Now, the important thing to note with these flaps is because flap C and flap B move 2 flaps across, they're essentially a 90-degree transposition. What this means is the skin at the base forms a dog ear. Now, this dog ear that you can see here can be excised and trimmed if desired, but you just have to be aware you might get a dog ear at the ends of your 4-flap plasty. We'll now talk about the jumping man flap, or the 5-flap plasty. Now, this was colloquially termed a jumping man flap because it looked like a man jumping, but if you look at it closely, the jumping man doesn't actually have a body. The reason it's called a jumping man flap is because Mustade originally described it for apicanthal fold, and in his original description the diagram does have a body, but for purposes of first Webspace releases we use the jumping man flap without the body, which is essentially 2 opposing Z-plasties and a Y to V advancement. So the jumping flap man design basically has a Webspace you need to release and 2 double opposing Z-plasties, along with a central limb, which will be the Y to V advancement. We label these flaps A, B, C, D, and E. And essentially you have 1 Z-plasty on the left and then an opposite Z-plasty on the other side. And then your C flap is a V to Y advancement. A Y to V advancement. You end up with a B, A, C, E, D configuration. And essentially what's happened is A and B have swapped as the first Z-plasty, D and E have swapped as the second Z-plasty, and C has advanced in. And I'll demonstrate this in a more practical scenario on the chicken groin crease. So if this is the web space you want to release that has a contracture across it, we then design our 2 Z-plasties. What you have to bear in mind when designing the Z-plasties is that your two limbs on the top cannot be at such an angle that they would meet each other, as this would compromise the base of your two flaps. When designing the triangular flap or the C flap, this triangular flap is going to advance into the web space, and I usually design this on the dorsum of the hand as the skin here is more mobile. The actual cut that you make to advance the triangular flap into, I make at the end because, again, you don't want to compromise the base of your other flaps, and you might not need to use the entire length of that split, which I'll demonstrate now. So we release the contracture or excise the scar, and then we raise our flaps. As you can see, I'm not making the cut in the middle for the V to Y flap yet. We are stitching in our two Z-plasties first, and then now our triangular flap is present with the apex underneath the skin. So we now release that middle part of the flap so that our triangular flap can sit in as a V to Y advancement. And as you can see, I haven't released the entire length, I've just gone halfway, and this is enough for this flap to sit in comfortably, and I've not compromised the base of my other two flaps. And we stitch this in, and we find that we have completed the 5 flap plasty, and there's no longer a Webspace contracture across the groin's crease. So again, in order to orientate yourself, the triangular flap which advances, I usually put on the dorsum of the hand, as this has more mobility as opposed to the glabrous skin on the other side of the web space. We now have a concave surface which is not tenting across the groin crease any longer. And if we were to name these flaps again from before, it would be B, A, C, E, and D. Please do hit the like button and also subscribe to our channel to enable us to continue to create exciting, educational, free content for you.
Sharpen, Masters of Surgical Education.